How's it going? Today we are going to be talking about open enrollment, specifically with Medicare. So if you're watching this, you've probably seen this book or you just received it. Cary, what is this book about?
Well, Amar, first I'm going to say you're probably the youngest person I've ever seen with a Medicare guide, um, but it's a pretty handy book. Right now we happen to be in Medicare open enrollment, and it actually would be hard for someone who's on Medicare to not know that, right? Based upon the TV ads that they're seeing, the radio ads, the social media ads, their mailbox is probably stuffed with flyers, and it's really companies just trying to help people make a decision and to sell them a product, right? There's a lot of really good information out there, but at the same time, there's a lot of misleading information out there as well. So, what I thought we would do today, Amar, is just talk about Medicare open enrollment, answer some of the more common questions about open enrollment, and then also, leave our clients with some trusted and reliable resources to help them, kind of figure this out on their own.
Absolutely. So let's start with Medicare open enrollment. What are
Okay.
some key things to know about that?
Well, the first thing to know is every year it's October 15th through December 7th. So we're at the beginning of open enrollment now. The reason Medicare open enrollment exists is for people who have Medicare Advantage or Medicare prescription drug plans to be able to make changes. And so if you have one of those plans, the reason the government wanted to have open enrollment and give a person a mechanism to make a change is because Medicare Advantage relies a lot on networks. Those things can change throughout the year, and you may not be satisfied with your doctor. Your doctor may have left the network. The company may have changed networks. So it gives you an opportunity to get another plan and make sure that you're staying within a good network. Also, on the prescription drug side, those plans change frequently. Your plan may have been discontinued, might need to re-enroll in a different one, or maybe you start taking different drugs in the past year, and another plan may cover that drug better. So, open enrollment is not really for people to make changes to their Medicare supplement. A person can do that at any time during the year. However, open enrollment is still a pretty good time to review it and see if you have the best supplement plan.
Yeah, absolutely. Especially when we see like articles or news events with like Rite Aid, uh, claiming bankruptcy. A lot of
Right.
these Medicare Advantage plans are tied to the prescription provider, and so like there's like United Healthcare has this CVS plan,
That's
right?
right.
Where that's where you
Mm-hmm.
get your prescriptions, and so a lot of changes happening there. So during this period of open enrollment, do you have to make changes, or is this just a good place to review? Like, what should we be thinking here?
Yeah, that's a good question, Amar. A person doesn't have to make changes. If you're happy with your premium, happy with your providers, and happy with the way your coverage is, um, then you don't have to make any changes. And if you do nothing, everything will just continue uninterrupted into the next year. Now, sometimes you might have to make some changes if there were changes to your prescription drug plan, right? You might need to select a different plan. If you didn't do anything, the company will most likely re-enroll you in a similar plan, but it's still probably best if you look at the plans and choose them yourself. And so you don't have to make changes, but for a lot of people, it is a good idea to at least explore and see what's out there. Can I get extra benefits, or can I save a little bit of money? Have my premiums gotten too high? It's just a good opportunity to check those things and see if it's a good time to make a change. But
Yeah,
you don't
and
have to
I
do anything.
yeah, and that's good to bring up is that you're not forced to make a change, right? Like if you're happy with the plan that you have, everything is staying the same. You don't need to do anything,
That's
and I
right.
think that's a good at least to review. Now, Medicare Advantage and then Medicare supplement plans. Um, what are the differences between the two? I guess like because oftentimes uh, you see these commercials that say free Medicare Advantage plan includes a healthcare membership and et cetera, et cetera. But is it really free? Like, what is the differences? What are the trade-offs? Let's dive into that.
Yeah, that's another good question, Amar. In fact, this is where some of the disinformation or misleading information can come in that you see in some of these ads. It is possible to get Medicare Advantage plans that don't have any premiums and also have additional benefits like dental coverage and will maybe include prescription drug coverage, right? But at the same time, Medicare Advantage has a lot of limitations on doctors and hospitals. So it's important that you stay within their network. And those networks can be restrictive, like a PPO or an HMO, right? And so you have that restriction. And then also you have a fairly high what's called a MOOP, a maximum out-of-pocket expense, right? MOOP. But the maximum out-of-pocket with Medicare Advantage for 2024 is $8,300, right? So between co-pays and hospital co-pays and deductibles, you might pay as much as $8,300 out of pocket. On the other side, Medicare Supplement typically has a monthly premium ranging from around $100 to $200 a month, depending on which plan you get. So there's a higher premium, but you have a lot more choice. You basically can see any doctor in the country. And so if the best doctor for your illness is in Chicago, and as long as you can get an appointment with that doctor, Medicare is going to cover it and your Medicare supplement is going to cover it, right? So you have a lot more flexibility. There's no networks. And your maximum out of pocket expense is in most cases going to be limited to your Part B deductible, which is about $184. I'm sorry, $174.
Yeah. No, this is a big advantage with Medicare Supplement not being tied to a network. Oftentimes we're working with clients that are in the transition phase into retirement, and at this time of your life, you're also having grandchildren. You're having and your children may not be in the same town as you, so you may be living in California. You have kids in Boston. You have kids in Atlanta. And now you want to go visit grandchildren and you're traveling. And if there was a medical emergency, you're going to want to make sure that you could get coverage in those different areas. And a lot of the times, Medicare supplement plan would put you in a better position to get coverage in those terms. Now, Advantage does have an emergency rider, right? Which would cover some, but I have clients that are snowbirds, right? So like half the times in Boston, half the times in Palm Springs, right? So those emergency riders don't really help out in those type of situations. What are some resources that we could give people to kind of take a deeper dive into this and to look into this more?
Yeah, there's a couple of good resources. One of them is Medicare.gov. That's a very consumer-friendly website that can help you understand the differences, help you select a plan. They have loaded in there all the plans available in your area so you can compare cost and things of that nature. So it's a very good website. If you prefer to talk to someone, it's 1-800-Medicare, right? So both of those are very good, very consumer friendly. And there's also the state health insurance assistance plans, which most states call it SHIP. And you can reach them at shiphelp.org. And they also provide some really good, helpful, unbiased information on making the best choice for Medicare.
No, that's great. Thank you for providing those resources. And for our clients, if you have questions or concerns, we're more than happy to help guide you through this process for your financial plan. And if you're not our client, please think about subscribing to our newsletter, our YouTube channel. There's tons of good information that we're trying to put out there in terms of giving you a sounding board to make some of these decisions or asking the questions that poke into your mind what you should be thinking about while you're making these decisions. Thank you, Cary.
Yeah, thanks, Amar.
Yep. Bye.
Bye.